Hello. Today I'm going to be telling you about Hello. Today I'm going to be talking to you about the ethical dilemma of clinicians providing treatment for their friends. At some point during your career, you will likely be asked to provide medical care to a family member or to give informal or undocumented care to friends, neighbors, or colleagues who are not your patients. Treatment for these individuals can range from refilling a prescription, discussing a recent injury, or ordering a test to perform major surgeries. The ethical risks of caring for relatives or friends or providing informal and undocumented care are substantial, but they are often overlooked. Although there may be limited situations in which providing medical treatment for friends and family is acceptable, these situations are often hard to differentiate. According to the American Medical Association's Code of Medical Ethics, it states that physicians generally should not treat themselves or members of their immediate families. Unfortunately, these statements leave a gray area because they don't directly state that healthcare providers should not treat their friends. So, what does one do if a friend is in need of care? Well, I'm here today to tell you about some of the risks that could possibly be associated with providing care for a close friend. First of all, professional objectivity may be compromised when an immediate family member or friend is the provider's patient. This could result in the provider's personal feelings unduly influencing his professional medical judgment, thereby interfering with the care being delivered. Additionally, the provider may fail to probe sensitive areas when taking the medical history or may fail to perform intimate parts of the physical exam due to a close relationship with a patient that makes this process uncomfortable. Similarly, patients may feel uncomfortable disclosing sensitive information or undergoing an intimate examination when the physician or primary care provider is an immediate family member or friend. Finally, there are concerns regarding patient autonomy and informed consent when providers attempt to treat someone with which they have a close relationship with. The patient may be reluctant to state their preference for another physician or decline a recommendation for fear of offending the provider. Likewise, clinicians may feel obligated to provide care to immediate family members or close friends even if they feel uncomfortable providing this care. One study found that 99% of physicians reported loved ones' requests for medical advice, diagnosis, or treatment. Study findings determined that 15% of hospital physicians had served as the attending physician for a primary or family member, and 9% had performed elective surgery on a relative. With these risks in mind, it is ethically not appropriate for the clinician to provide care for the friends, considering these individuals tend to function in a way that is similar to a family member. This means that they too are at risk for compromised provider objectivity that could result in poor delivery of care. As a healthcare provider, you want the most appropriate care for your patient, and as a friend, you want to be sure your companion receives the best form of care. To prevent objectivity and ensure the best care is provided, healthcare clinicians should advise their friends and relatives to seek care from another provider who does not have the emotional involvement and ties as you would likely possess. So yes, these are difficult issues, and that decisions may not always be straightforward. However, the American Medical Association, along with several medical societies, has emphasized the ethical pitfalls in informal care and strongly advises against it. It is my hope today that if you ever encounter a situation like this, you will think through the potential ethical conflicts before offering informal care. Thank you.